Thank you so much for inviting me. My name is Felix. I'm an infectious disease specialist at Aga Khan. I think I'm one of the only non-neurology or and it's such an honor being here with people who are my mentors. So Dr. Hooker was my consultant when I was a medical student. Dr. Sylvia, Dr. Kwasa were my residents then. Prof. Soki has taught me, so it's a real pleasure to give you this talk. So the bird's eye view is quite big, so I won't cover everything, but just to show you that the associations of stroke with infections is quite large, and I think one of the first things that had been noted was that it seemed like people who are getting systemically ill with other infections, so even with sore throats and mouth infections, seem to have a higher risk of getting especially ischemic strokes, all other factors taken into account. And so it's good to have this view in our heads. And then, of course, pneumonias, and this is because they cause pretty severe infections. So strep pneumo is an old bug and a bad one, and even without causing meningitis has been associated with stroke. And then going down the list, we have the ones that cause the vasculitic syndrome. So they are not typically involving large arteries, and they may. And so we have that whole list there, starting with HIV and just going down the list, and syphilis. And then endocarditis, of course, and not in this part of the world, Chagas disease, where we have dilated cardiomyopathy. So I'll spend most of the time talking about HIV and stroke. So I think pretty early on in the HIV epidemic, one of the things that was noted was that even controlling for traditional risk factors for stroke, HIV seemed to confer a higher risk of ischemic strokes in particular, above those who were HIV non-infected. So I think this is one of the associations we've seen, and we'll talk a little bit about this. So just looking at all these studies, just trying to correlate HIV and increased risk of stroke, and showing what kind of strokes were associated. I think the interesting thing to see is that infectious causes and cryptogenic causes, which Dr. Kalebi was talking about, are quite a few, especially if you look at the one from Malawi, which is more within our context, which showed that a large proportion of the strokes, the acute ischemic strokes, were actually because of infections within the HIV population, and proportionally large amount was cryptogenic, not known at the time. So there was this large systematic review that was done by Abdallah and the group there. And I think what I wanted to bring out was that for these people who had, it was looking at basically description of ischemic strokes in HIV positive patients. And I think one of the lessons to take out of it was that most of them had really low CD4 counts. So this was, it's not that old. I mean, some of the studies are, they're less than 10 years old. I think one of the studies, one of the lessons to take home is that we really should be testing a lot of people for HIV, if not everyone.